all. This is Dr. Mobeen Sayed from drbeen.com. Welcome to the second show for today. Jim from Iowa is first today. Yes, Jim, you're first today. So Jim is here. Welcome, Jim. D. Diaz is here. I hope I'm pronouncing your name correctly, D. Diaz or DDs. Jim, welcome. James Crooks, hi. So let's just wait for a couple of minutes. And we will. Jenna, how are you doing, Jenna? So my oxygen saturation, 98. I think I don't know what happened, but anyways, it was showing to be 98. So welcome, everyone. So here is a report from my health. And again, believe me, it is not that I'd love to talk about my health and that is somehow something important, but it is mostly interesting because it may or may not be COVID, number one. Number two, the symptoms are interesting. Number three, the treatment, the management regime that you're seeing me using it as well. And then you would also see that I am doing some experiments. One experiment almost got me killed, not killed, I'm dramatizing, that skipping the ivermectin. The other experiment I did today was that since the morning till now, neither have I taken any supplements, which is fine. Supplements can be skipped a day and the previous one would still be there, or the new food that I've eaten would have things. I have not taken any anti-inflammatories. So no ibuprofens, no Tylenols, no aspirins, nothing. And today I don't even have nasal congestion, and I have nothing, no fever, no congestion, and the oxygen saturation has been fine. The whole day I have been working and I have been totally 100%. So now, question for you. Should I now stop ivermectin today? And then in next 2 to 3 days, should I start my steroid therapy and then do that? What do you think? So this would be, today is the 7th day. Sheila, thank you very much. DDS says no more experiments. Absolutely. But I wanted to see that, is it the anti-inflammatories that are keeping me up, or is it the ivermectin, or is it the combination? So we saw that when I skipped ivermectin, I had a drastic response and fast. And the other thing that I kept noting is that every day after about 15, 16 hours of ivermectin, I would start developing congestion. So that is the ivermectin. Today, I have not developed that congestion either. The second thing is, I was kind of interested in seeing what ibuprofen is doing because I was taking high dose ibuprofen morning and evening. And so I left that out today to see if that has an impact, number one. Number two, I wanted to see if my fever is actually gone, if my congestion is actually gone, and so on. So today, there is no fever, no congestion, no chest issues, and everything is fine. I didn't even develop that congestion that I would develop slightly runny nose by this time, and I didn't have it. Although you may still be able to hear some nasally sound, that is just I'm recovering, but it used to be much more congested. The feeling and the runny nose, and that is not there. Okay, so Margaret says, please keep taking ivermectin. So that is Margaret's opinion. Got it. I like this one. So Anne says, I can't give an opinion on ivermectin. I am an HCQ girl, Dr. Bean. So maybe I should start hydroxy. I want chest accident contrast CT. That is a good thing. Although I have been using my stat as well to check my chest and all clear. Although I'm not using this stat, there's another. A Simple Garden says, I took for 5 days, then once per week. I believe it's the anti-inflammatory for me, but I was a long hauler. You would still be early in the disease. Correct. So vote, tell me. So Charles says take Tylenol instead of ibuprofen. Okay, so the thing is this: I don't have any congestion, I don't have any fever, I do not have any pain, I have nothing. So do I need to have Tylenol or ibuprofen at all? So M. Gregory says, take ivermectin just in case there may be a variant. Okay, so should I now switch to ivermectin prophylaxis, or should I continue to take ivermectin as active disease for some more days? So Patricia says you are taking 2,000 milligram of ibuprofen a day. It may take some time for a fever to manifest if you do indeed have one. So the thing is this: the half-life is short. So even when you take ibuprofen in larger dose, although too large of a dose can be very risky, but the liver, if you have not overwhelmed the liver, it's going to chop it down in the right half dose. So I took my last ibuprofen last night after the dinner with ivermectin, and till now, so it's almost 24 hours, I have nothing at all. PCR and blood levels. Steve says stay as you are for 2 more days, then reduce the ivermectin dose by steps and see what happens. Okay, so I think generally I should continue with ivermectin. The next question is, so it is 7 days. Normally 7 to 14 days is when the B cells would have become active and the antibodies are being produced and we are getting out of the viral phase and entering into, if at all, cytokine phase, which I think, fingers crossed, touch wood, which I think I will not. And that is the phase to then take steroid therapy and to, number one, prevent any long haul outcome, and number two, any cytokine possibilities. So do you think that tomorrow or day after I should start these steroids? I usually start steroids at 7-8 days, meaning tomorrow, day after, if it is a patient, I would have started them on steroid short therapy. So LD says that don't analgesics repress our immune system, which would respond better with the fever? They don't repress the immune system. They actually block interleukins, which is inflammatory part of the immune system. Yes, you can say it, but immune system is functioning. Yes, if we have fever, then we fight better with the viruses and bacteria. So Nancy Camp says no steroids, no lung symptoms. Yeah, so I don't have any lung symptoms. I think there was one day that I had slight phlegm from my bronchial area. If I'll do, I would feel that I have phlegm, but I didn't develop bronchitis. I did not develop lower respiratory tract infections. It seems like, if I tell you the truth, I think it was rhinovirus because it was all contained majority here. I don't think it was even COVID. So what do you think? What is the final prescription from Cool Beans? So let's see. France says, remember silent hypoxia, Francisco. But here's the deal. The hypoxia, I have been checking. So this is my most common thing that I've been doing, and that is to check my oxygen levels. And this meter is weird. It goes to 96 and it goes to 97, then 98. So it has been 98. So I don't think that there is silent hypoxia going on. So Lady Tao says, leave it alone, just continue on the ivermectin protocol. So I'll do that. So Nicholas says, sorry, ivermectin worked on rhinovirus for Dr. Bean, possibly. Or I may have COVID variant that was less clinically bad. Kathleen says, I would stick to what I said earlier, then stop steroids on day 14. Okay. Okay, so then the Discussion then becomes, as Margaret was saying in the beginning as well, we continue with the ivermectin. I see Jody's message here as well. Jody said, guys, messages are scrolling fast, so please don't mind if I didn't show your message. Jody says, I think 3 more days, ivermectin steroids play by ear. I think that too. I actually thought I did not need ivermectin, steroids. Barbara says, treat it as though it is C19 and see Dr. Drbeen comment because he's successfully treating patients with ivermectin. Yes. Do you know something very interesting is that there are some doctors from here as well who are now reaching out to say, please tell us what would be your protocol. Jenna says, not feeling well, going to shut eyes, voice still weak, love you all. So Jenna, hopefully you are recovering with ivermectin, stay well and rested. Simple Garden says, you don't need steroids if you are on ivermectin, but Denise TD is correct. You need aspirin and fluvoxamine or fluoxetine. Don't we need fluvoxamine or fluoxetine if I have some neurological symptoms? So far, I don't. So my thinking is this. Continue with ivermectin, maybe take anti-inflammatory and analgesics for a couple of more days, but not in that high of a dose. Continue with supplements, that I should do anyways. After 2 or 3 days, I switch ivermectin to more prophylaxis, and then maybe I take a short therapy of steroids. Although it seems like steroids are not needed, but just to complete the protocol, we do that. So Kathleen says, yes, fluoxetine only got when the brain fog. Christine says, Dr. Bean, did you see Pasi's comment to you in the comments after yesterday's posted video? I had seen his comment day before yesterday. I did not see yesterday's comments yet. So I'll go check them out. I hope he's doing well. We love him and we wish him well. Margaret says that sounds like a plan. So awesome. We will go with that plan. Steve says, if you take the steroids, you won't be able to compete at the Olympics. You crack me up. Yes. Yes, I understand that part. Safer Steve says, 3.5 article in JAMA, 5-day course of ivermectin does not improve the time to resolution of symptoms compared with placebo for adults with mild COVID-19. I saw that yesterday with the cool beans. I have to actually dig deeper into it. To me, it seems interesting that as the ivermectin momentum is building and as the CDCs and the media, who wants to always be one of the opposing factor, as they need such studies, the studies have started popping up. Machiavelli says, you never had loss of taste or smell. No, I didn't. And I actually made sure that I would check every day, multiple times to see, can I smell? And so I was able to smell fine. Nothing with my GIT. Majority of the discomfort I had was either nasal or some oropharyngeal area, some nasopharyngeal area here. One day I had, when I left ivermectin, I had slight swelling here, which meant my lymph nodes were swelling up because they were now fighting more. So I had to do some neck massages, and that's about it. Once I started the ivermectin again, I have been, you can see, this is how I was yesterday as well. Samina says, you make ivermectin popular. Yes, so ivermectin has become popular, and so now there are, did you see this note? I'm sure that you've seen it. Let me just very quickly show it. I tweeted that as well. CNN ivermectin, they said today, this one. FDA warns against using antiparasitic drug for COVID-19 after reports of hospitalization. So one, this is kind of interesting that they would actually put this word here, antiparasitic, and that right there in the heading tells you they're leaning. And then secondly, if you see here, it is very interesting. They say taking large doses of this drug is dangerous and can cause serious harm. I can actually change this and say taking large doses of any drug is dangerous and can cause serious harm. So this statement is true for ivermectin or for remdesivir or for steroids or for anything. Then they had one more statement here which was very interesting, which was disingenuous. And usually people will not catch it. And let me see where that was. So treat or prevent. This one, look at this. Ivermectin is often used in the US to treat or prevent parasites in animals. That's fine. In the US, it is the prevalent site, but this is not for animals. This drug is actually the drug that has removed the worm infestations in the whole world in humans, in a majority of the world. And now we are seeing ivermectin very effective against some viruses as well. And they know that it has been used for Ebola and other. So this was also a disingenuous statement. Then there was one more such statement. I was actually reading those statements and cracking up to say, look what they're doing. So then they say you can also overdose on ivermectin. You can overdose on any drug. You can also overdose on ivermectin, which can cause nausea, vomiting, diarrhea, hypotension, blood pressure, low blood pressure, allergic reactions, dizziness, ataxia, problem with the balance, seizures, coma, and even death. The even death part, I am not sure about. And seizures, yes, very rarely. This part, we have always been talking about it, that why would this happen? Look, they could have FDA could have made it better by saying doctors should be able to use ivermectin. Please make sure that you are aware of the side effects and make sure that you look at the patient and decide what are the side effects that they should not have, or what are the risks that they have, and then do a good job there. So on one hand, they are suppressing it all. And then when people are escaping from that suppression and they are going, and for God's sake, people are taking horse ivermectin. I was so disturbed last night when I was thinking that what have this come to, that people in the US are having to take horse ivermectin because the country will not support them. How shameful is this? The announcement comes just a day after new research published. So now look at the basis. So as they needed this, the research has popped up. This is that research we looked at yesterday. I haven't unfortunately gone into the depth of it to see what did they really do. The drug is cheap medication with anti-inflammatory properties, and it seemed to stop the virus from replication in lab studies, but more research is needed to determine how the drug performs. So this, again, is a non-journalistic statement because there has been a lot more research. This is not just this one study. So what they've done is they have picked and chosen these statements to craft a piece that can then stand in opposition to ivermectin. Same behavior like hydroxychloroquine. How can these, and again, I'm not being right-winger or left-winger, how can Fox is equally responsible for doing such weird, crazy things? How can they even look at us eye to eye when they do this intentionally? So William Goff says, I personally took horse-based ivermectin weekly for 3 months and 3 family members. We all were fine. So good to know. But look, we're talking America. We are talking the most expensive healthcare system, which should also translate into most sophisticated, most fast, reflexive, alert, efficient healthcare system. which would protect its people. And here we are, people having to take horse paste. Yeah, Rick says 26,000 hospitalization from Tylenol every year, and that is over the counter. They gave ivermectin to the control group, so it appears the two groups are similar. Why did they give? So I heard that they did it. I have not looked at the data, so I don't want to just go to a rumor. I'm going to look at it. Why would they give ivermectin to the control group? Then there is no difference between them. Tom says, I bought ivermectin online, was shipped from India. So I can tell you this. Imagine that what happened to me was COVID. You saw that one day skipping. You can actually still go back to that day's video about 3 days ago. Skipping it one day brought me down so fast. And then starting it again, I'm fine. You think it is a placebo? Even if it is placebo, this is great placebo, very cheap placebo, and does not do anything. It would actually help with the worms as well if I have any. So, so it is this unbelievable the way they are doing. JTJ says Ivermectin 24H is the website. Manuel says the bias against the chip medicine. Yeah. This is a very good question here. Tom says, is zinc helpful with ivermectin? No. So ivermectin itself is not a zinc ionophore. So without ionophore, whatever zinc can go into the cells naturally with the natural other ionophores like quercetin type things in our food, that would do it. But either take hydroxy or take quercetin. Barbara says it's called screwing up a study. Yes. LEG says, hi, Dr. Bean. Question. So will pregnancy be safe if someone, both male and female, have been vaccinated? Should they wait for some time before they plan for baby after the vaccination? No. So vaccine has just trained their immune system and it's gone. Their immune system is now ready for the virus, and that's it. They are fine. So they can plan and they can have babies and enjoy new family members. B12 says, for science, I'm willing to test 2 cheesecakes. I am willing to eat and drink things as well for science. Nicholas says, because some idiots overdose on ivermectin, it's now not recommended for everyone. And that's the thing that, look, this is why I keep saying people who are overdosing, this is what happened with hydroxy as well. They are anxious. They want to protect. They don't want to overdose and die. They are actually trying to protect themselves by taking it. So if we actually can provide the right guidance, if we stop suppressing this stupid guidance, the stupid way of saying that these drugs are, then people will know the right thing and do the right thing, and doctors will do the right thing. What is happening is, the more they're suppressing it, then people are becoming anxious, and they're hearing from here and there to say, okay, this works, and then they're trying to do whatever they can. This is actually FDA, CDC, NIH. This is their fault. Steve says, since when did money buy efficiency? So there's a question from Colin. The UK Daily Mail did a piece about ivermectin entitled Scabies Drug Could Cut COVID Deaths by 75%, but if you read it, goes on to say it could be £50 instead of the 2 cents the WHO says. Yeah. I actually think that even with £50, or over here, like, for example, when I went to get it, it was $226. That still is a better trade-off for life and safety than to be a victim. So Starla says, is the vaccine safe for the people with the grave disease? So I would rephrase this question as, is the vaccine safe for people with autoimmune diseases? Yes, and it is actually recommended. At the same time, your doctor should know your history so they can understand what vaccine to use, what dose, if the dose is okay, if the preparation for any autoimmune response. It is not actually seen. The side effects are not actually tied to autoimmune disease people. So it's not that if somebody has autoimmune disease, then they are going to have side effects. That's not the case. It is just that some people have more side effects than others. Manuel says, I took ivermectin and azithromycin for 5 days and I was okay by the second day. That is how strongly and fast ivermectin works. I'm surprised. And that is how fast it stopped working when I skipped it. Don says, I'm a long hauler. I'm using quercetin and hydroxychloroquine prophylactically with supplements too. Still, is there any reason I shouldn't take both at this point? So if you're already a long hauler, um, there doesn't seem to be a need for prophylaxis anymore. I would rather say that we need to now manage the long hauling and to cure that part. If you are a long hauler, that means you've already developed your protection. France says, Anthony is so glad you're getting it. What is Anthony getting that I did not read? Um, So Anthony, here I had refill with my ivermectin without insurance today and still was only 45. Did you use good RX or even without good RX as well? And is it helping, Anthony? Absolutely, Doug. Compared to 1 day in hospital, just being in hospital is kind of scary. Correct. That's the thing. So fishtail, this is what is important. Nevertheless, docs will now not be willing to go against FDA. That is the thing. Although FDA has said that we are not pro or against, was it FDA or CDC? We're not pro or against. But I don't know if they have actually updated it again to say we are against. They are saying, let's see what is the exact statement. I hate it. I hate to read it in the newspapers. Instead, I'd like to see it on this actual site. The US FDA said the people should not use ivermectin to attempt to treat or prevent COVID-19. Let me see if I can actually. Okay, so I'm going to share my screen. So, Fishtail, you are correct. Because here, FDA, why you should not use ivermectin to treat or prevent COVID-19. So this is on FDA side. FDA has not approved ivermectin for use in treating this. So of course, you are correct, Fishtail. Doctors are not going to go against them. Taking a large dose of this drug is dangerous. Large dose of any drug is dangerous. If you have a prescription for ivermectin for an FDA-approved use, get it from a legitimate source and take it exactly as prescribed. Never use medication intended for animals on yourself. What is wrong with them? This is not intended for animals only. Okay, so they're saying, okay, don't take horse-based or others. Um, I wish there was a way to hold these people accountable. They can get away with saying these things because there is no accountability. We cannot say them anything. And so, yes, Fishtail, you're correct. Doctors are not going to prescribe it. So that means those 10, 12 doctors who are doing it, even they would now start becoming careful. So Chad says, will ivermectin affect blood pressure meds? It does affect the blood thinning meds, which in turn can affect the blood pressure, but generally not the blood pressure meds directly. Sherwoody says, shortness of breath for 2 months now. Antibody test still shows both IgG and IgM positive. Any idea why that could be? Started methylprednisolone today. So for a couple of months, having IgG is actually fine. IgM should stop dropping down. So this means you may actually have the virus somewhere. That's very interesting. Okay, let us. Ideally, there should not be a virus at this time. IgM and IgG still could be because of that immune dysregulation. Let's see once you have the steroids. TD says, my wife got the Pfizer dose today. Very good, excellent. Um, yes, France, that is the problem. Don't take horse paste, but we're not going to let you have the ivermectin anyways. So what are people going to do who are becoming anxious for their life? They're going to go have horse paste. That is what's happening. LEG says, is vaccine safe if children are autistic with learning difficulties age 5 to 10 years old? So again, now this is something where there is controversy that vaccines cause autism. And so I'm not going to sit here and go against or pro, because various people have various experiences and I do not have all those experiences to be able to say one way or the other. Generally, vaccine should be safe. The question is, why are we giving vaccine to a child who is 5 to 10 years old? Vaccines are mostly approved 18 plus. William says, what's your opinion on vaccinating children? The vaccines are relatively safe and low incident of adverse events, but also the incidence of severe disease in children is low, which is lowest risk. So I think this is why the 18 years and younger are not getting vaccines, because they are not at that high of a risk unless they have any comorbidities, for example, type 1 diabetes or cancers or immunosuppressions, in which case they should be given vaccines. Simple living, you should put, so simple living, do you have a question? I usually scan for QQQ and then find those and respond to them. Even then I miss them. So my apologies. And Simple Steve says, hit the like button. Yes. So this is a very good question, Universal Philosophy. What dosage of ivermectin are you taking per kilogram and for how many days? So I am, let me show you. Give me 1 second. So I have this one. This is ivermectin 3 milligram tablet. I am taking 4 tablets daily, once after dinner or during the dinner. So that means 12 milligram. And so this 4 of these, for example, today I'll take 4 of them. So this means about 150 microgram per kilogram body weight, or 0.15 milligram per kilogram body weight. That is on the lower side. The therapeutic range to take once in a 3 months, 6 months, 1 year is 150 to 200 microgram per kilogram body weight. So I am actually still taking outside the therapeutic range by taking it more frequently. Nancy says this is a great question. Nancy, which one? So JTJ says I take between 0.2 and 0.3 milligram. So 200 microgram to 300 microgram per kilogram of body weight. Steve says, my parents got their second dose of Moderna today and I got dose 1 of Pfizer yesterday. None of us had any side effects, reactions. Does that hint we already had some immunity? No, that simply means that your immune system behaves in a way that it didn't cause too much of inflammation, which is totally fine. Simple living. Can a person take ivermectin if they take at 81 2 milligrams 3 times a day, or will it cross the blood-brain barrier? No, I don't think it will. But again, this is a question for a specific person. The question is for their doctor. Chad, thank you very much. Michelle says, create a think tank on how to make FDA, CDC, and WHO accountable. Yeah, that we have to think about. I am so surprised. They can get away with whatever they want. Even, do you know what I was thinking today? Some of you may not like. we say that in the US, we care for American lives a lot. And if someone in the world threatens their life, any American interest or life, we go hard, we eliminate them, we fight with them, we spend millions and billions and trillions to make their lives difficult. And here within the US, people are taking horse paste because our own institutes are letting people die. 500,000 deaths. So, what kind of a care is this? So, is this just a I so I'm an American as well. So please don't think that I'm criticizing America just for the criticism of it. But this seems like disingenuous to say we care for our people and then have our people in a state where we are taking horse paste because you would not let us have the right. What kind of a freedom is this? So yes, we got to figure out some way of making them uh, accountable. Simple meerkat says horse paste for dinner. Yeah, so maybe now that FDA is saying this, so I have this for the time being, and when this finishes, then it's going to be replaced with a horse paste as well. Lady Tao says this situation has revealed all the cracks that were there for a long time. Absolutely correct. And yes, Colin, I am so surprised as at UK. UK is even more horrible in this sense that over here, one a doctor can still come up and say, you know what, I am going to give you ivermectin, which is happening now, or I'm going to give you hydroxy, like with Dr. Zelenko. UK, I'm seeing that nobody is willing to give ivermectin. People are purchasing it from India, and it comes after weeks and so on. What a horrible situation. Correct, Jim. Um, $22 says, question FLCC says 5 days maximum for ivermectin for early outpatient treatment. Why have you decided to take it longer? So it is the same situation for them or me. What that means is they're saying is mine is as good a guess as theirs, and theirs is as good as mine. There is no study for how long to give ivermectin. This is a standard thing to say for antibacterial. 5 days therapy minimum is necessary. So saying for 5 days is kind of in that kind of frame. I have never used 5 days with ivermectin. I have always done so. I've started using ivermectin for my patients way back, many months ago. And I always said, continue giving ivermectin until the patient has come out of it. They don't have any symptoms. Their oxygen saturation has come back to 98 and they're feeling fine. And then you stop ivermectin. So if I take that advice for myself as well, I'll continue until I feel fine. So I actually feel fine today. So I, from my own advice, I could say stop today, but I'm going to continue for a couple of more days. So there is no rationale between 5 days or 10 days. And if you go for a technical part of it, any book or any study will not come back and say even for 5 days. They'll say once a 3 months or 6 months. So all of them are wrong in that way, including me and FLCC. But luckily, it is safe drug. Luckily, it has a half-life of 18 hours, so it is eliminated as well. And then this is a fair question that if it is 18 hours half-life, then why does it keep working for a month when we do prophylaxis with this? And that still needs to be figured out. So doesn't matter if it is 5 or 7. If it is correct, then both are correct. If it is wrong, then both are wrong. Janet says, don't demonize everyone, Colombia over this. I honestly believe, so you're talking to Colombia. We have Dr. Daniel Griffin, parasitologist for NIH reverse recommendation. There are doctors who are trying to fight this. Um, Jason says, my mother had her left axillary lymph nodes removed due to breast cancer 3 years ago. Should she receive the COVID vaccine in the right deltoid? Doesn't matter. So again, not a specific consultation for any specific patient, but doesn't matter. Even if the axillary nodes were removed, depends how many. If this was total removal of all the axillary nodes, and she has developed edema in that, then of course other arm is better. But if her lymphatic drainage is still correct and her arm is not swollen and she is functioning fine, then it doesn't matter. So I think that is where her doctor has to assess and decide. Yes, Charles, everybody hit the like button, smash the like button, and also smash the bell button as well. So JC says, what is the dose of ivermectin for prophylaxis? So I'm going to use flccc.net just so that you can actually go and see it over there. You can see the other things to be taken as well. They say 0.2 milligram per kilogram body weight on day 1 and day 3, and then bi-weekly after that. Yeah. But think about it. Thank God for these doctors. But at the same time, when they are going to read this statement today, what are they going to think? We are at risk now. And if, God forbid, somebody has some side effects or somebody dies, these doctors are then going to become exposed to litigations. That is why, what are they going to do? They're going to just simply say, you know what, we're stopping. We're not giving ivermectin anymore. And will anybody be able to go and stop FDA or hold them accountable for this? No. FDA would say we did our job. Fatma says, what ivermectin dosage for long haulers? So what I have never given ivermectin for long haulers because I don't have long hauler patients. What I've seen with FLCCC is the same dose like prophylaxis bi-weekly ivermectin. I have seen some doctors using weekly ivermectin and lesser than the full dose. So, for example, there's one of the cool beans here, and she says that she gets 3 milligram per week. So I suspect that 3 milligram is for 15 kilogram person. I am sure that she is more than that. So maybe she has 9 or 12 milligrams need, but she's taking 3 milligram. If I was the one managing, I would give therapeutic dose, that is 150 microgram per kilogram body weight to 200 microgram per kilogram body weight. That means for a 70 kilogram person, about 12 milligram one dose one day and then weekly. But I would tend to manage a long hauler more with steroids than with ivermectin. Jason says, thank you very much. You're very welcome. Lee says, I received a prescription for ivermectin and my Walgreens pharmacist in Oregon asked me what I was taking it for. When I answered, he said he would not fill it, said not FDA approved, blah, blah, blah. No one has held AMA, American Medical Association, responsible for them going against hydroxy with pharmaceutical associations and then retracting their statement in November silently by saying we had no right to say this, that a doctor cannot use it in their off label. Dr. Bean ended up getting complaints about hydroxys and those and getting audited that we are still going through for 6 months. And these organizations made such statements, then silently recanted them, and there is no accountability. So similarly, this FDA, someday they'll just simply say, okay, we think it is fine. So try a smaller independent pharmacy. Yes. Someone saw worms in the pan. And Michelle, that is the weird thing, that Emma actually enabled pharmacists to go against hydroxy prescription of doctors. Now they are going against, pharmacists are going against the prescription of ivermectin from doctors. And again, nothing against the pharmacists. They're just trying to figure out what is the right thing. I don't think that a pharmacist should refuse to fill the prescription because they think doctor has made the wrong decision. The responsibility is with the doctor. So Anne says, I had to go off the books, Dr. Bean, and pay cash when I had the COVID from my telemed doc and mom and pop pharmacy for the sequencing. This is the weird thing. I am thinking you are in the US as well. Can you imagine? We are doing legitimate medicine as if, the thieves who are opening up their little western over here, they have things and they're saying, can I give it to you? This is how bad it has become. Thank you. So Doug, that is a good question. Should I get another PCR or antibody test? So I'm gonna talk with my doctor to say I want to have an antibody test. I know I'm going to be refused, but I think I need to get my antibody test. I'll get it. So art patent forever, is 18-hour ivermectin half-life for plasma levels or for tissue levels that could be much longer? Could tissue accumulate? It is possible that in tissues it lives longer, and it is the plasma levels. So Christine, again, I try always not to go for one person because I cannot. It's just not ethical for me to. So Wolff Parkinson White, of course, is a condition where tachycardia can occur. The technically, unless there is a chance of anaphylaxis, or there is nervousness with the patient that they would develop tachycardia out of their anxiety. I think in such cases, normally patients of Wolff Parkinson's type, they have their medications with them. And so there is no real contraindication there other than if there is anaphylaxis, then there needs to be management right there. And that is true for everyone. Or if they're anxious and they need to keep their heart rate in check, then whatever medications are given. So this is the doctor's talk with them and at the time of the vaccination. Correct. So Lifela says, Lil fella, Lil fella says, NIH took the stance neither for or against. Correct, they did. But look at what FDA just did. Yes, Susan, I'll do that. I actually have many cool bean MDs who can write it, but I want to do that. Mike says, I'm going to get D3 with K2 in one pill. That is excellent. Catherine says, Dr. Bean, you can order your own antibody test at LabCorp. I did it in Illinois and AZ, and I'm not a med professional. Can you do it in the CA? Let's see. LabCorp antibody test. So they're saying that go talk with your doctor that you may want to be donating the plasma if you want to, and get the test. So two ways: go through labcorp.com to request a test, get started. So possibly I can, or go to your doctor and say, hey, maybe plasma could be useful. So thank you. I am going to check it out, Catherine. Linda says, trust your doctors that have you on Ivermectin. Yes. Denise, got it. I will do that. So Texas says, how many days ill before antibody is detectable? Normally, 7 days onwards. In some people, 15 days. In some people, 20 days. But usually 7. Of course, in some people, earlier as well. So I am at 7th day. So in the next 2-3 days, it should be fine to get it. Kitty Krause says, go to give blood and you'll check antibodies. And yes, I think that is the best. We have a blood donation bus that stands here in a parking lot. TD says, did you see the funding of that new Columbia study? No, I did not actually dig deeper in it. So Jim says, antibody test cost me 30 cash at the hospital. Very interesting. Nancy says, no ivermectin, no plasma. Just kidding. France says, I don't think plasma works. Yes, but this might work to get the antibody test. Patricia says, but your antibody test is going to be negative. That's what I think, Patricia, as well. Gold Country says, new better test approved today. I do not know. Is that an antibody test? Steve says, I got an antibody test with physical in May with no issues. That's interesting. No couple concern for supplement. Agreed. Absolutely, Ambol. It is possible that I just had a common cold. Doug says, my doc asked me to stop Centrum because of biotin for 6 weeks before thyroid test. Should I try to find a multivitamin without biotin? Sure. Or just stop Centrum for some days. Meaning if all the rest is taken care of, the prophylaxis for COVID. Anthony, we could buy a case of beer and take Tylenol and destroy your liver. That's your freedom. Can't utilize the medicine proven to be safer. Yes. William, do you think COVID can mutate to a point it does start using these new antibodies from vaccine against us, ADE? No. For COVID to actually bind with the ADE and then use that as a weapon, it will have to really engineer a lots of mechanisms to pick up an antibody, then to hone it into the macrophage or dendritic cell or the mast cell, and then use that to get in and then escape the phagocytic lysosome more easily than it cannot do that today. So it would have to really, really develop a lot of capabilities. Anthony says cold don't seem very common anymore. Cool. So one couple of more questions and then we break for tonight. Fatima says question 27 milligram of ivermectin, 27 milligram for 125 pound is too much. Second for long caller. Yeah, so 125 pound 125 pounds to kilogram is 56 kilogram. That's very low. So 56 kilogram multiplied with zero point 0.2, even if it is 200 microgram, that is 11. So 12 milligram one dose for such a person. TD says Dr. Lopez Medina reported receiving grants from Sanofi, Pasteur, GlaxoSmithKline, and Janssen, and personal fees from Sanofi Pasteur during the conduct of the study. And the study says what they want to hear. We wonder why. And then CNN reports on it. And then FDA comes back and says, don't you use that. So James says, do questions come through to you when posted on Facebook? Yes, but usually there are very few questions there. And secondly, I think sometimes they don't put cues there, so I just don't see them. But just like I think you have posted a comment on Facebook and I can see it. Good night, Kathleen. So LF says, will getting vaccinated cause my autoimmune conditions to flare or worsen? That is not known. It is the vaccines are causing some people's immune system to cause side effects or anaphylaxis, but this relationship that everyone who has an autoimmune disease will get this flare up is not seen. So one more question, then we break. Janine says, been feeling funny, weakness of legs in morning for a couple of days. I took some ACV, made me feel better as if blood sugar was low. No other issues, just a heaviness and weakness of legs. Good. So just observe yourself, drink water, and just stay healthy, supplements and food. So far, it doesn't look like anything to do with COVID. So Jafar says, you can't see the chat questions, Mubin. I don't know. So, for example, I just see Meredith saying, thank you, Dr. Sayed. You are very welcome. So I'm able to see things, chat questions, hopefully as well. Cool. So thank you very much. Doug says we want more, Dr. Bean. Absolutely. So we'll be continuing our discussions tomorrow as well. If you want me to stay, I'll stay. Margaret says, thank you very much. Thank you very much, Margaret. So I had received a call about the leronlimab phase 3. So I'm going to look into that tomorrow and see if we can talk about it, or maybe even invite folks on the leronlimab from Cytodyn. That is correct. Vitamin C is great. And I have not yet seen the leronlimab results. So one more question. Paco to Ski says, would maintenance doses transplant meds, tacrolimus, mycophenolate, motile interfere with antibody test result? No, because the titer may seem to be a little lower, but it should not be unless the suppression is too much. I don't think so. Thank you very much, William. There are more questions. So Be Curious says, how are you able to contact Dr. Corey and Merrick? Do you have a bunch of other questions ready for them? So I usually reach out to them. I have their phone numbers and emails with us. So I reach out to them and say, hey, Cool Beans are thinking about you. So would you like to come join us? And then Dr. Corey had said, I would like to come back in 2 weeks. So maybe next week we can request him to come back. And this time we'll make sure that the mic does not have echo. We wear headphones. and same for Dr. Marek as well. And the questions I usually ask. So please remember, this Monday we'll have we'll have a doctor from Israel joining us from Israel at 11 in the morning, and we'll talk about the vaccination and what is happening there. Doug says, cool, late coming. We'll hang on with everyone. Welcome, welcome. Bambi says, Dr. Bean, can you discuss seizures and vaccines, please? So we'll do. Let's look at that tomorrow. I want to talk about Cytodine and this Pfizer as well. I want to talk about. Okay, so let's see if we can do that tomorrow. Otherwise, on Tuesday, because Monday we'll have the doctor from Israel joining us. Cool. Lady Tao, thank you very much. Lena says, have you compared vaccines? Not yet. So I have that on my to-do list. Barbara says, lectures, thank you so much, Dr. Bean. Please keep getting better and rest. Much love to you and your family. Thank you very much. And I am going to take Ivermection today. I'll take anti-inflammatories today as well. So with this, let's break for tonight. Thank you very much for everyone. Thank you for joining me. And please like, subscribe, and share. There are 3 links in the description if you would like to buy me a coffee, or if you would like to become a patron for this kind of service for healthcare professionals and students to make them as much improved with their clinical practice as possible. I think that is useful for the next people who would come and become doctors. And if you just wanted to support this work as well, there is a link for that too. Thank you very much, and I'll see you tomorrow.